Hello guys, welcome to AI Medical School, with a brand new video. So in this video, we will study about impacted wax cerumen. But before we start, if you haven't subscribed to the channel, subscribe to it and hit the like button. Let's get started. What is impacted wax cerumen? Ear wax is a mixture of secretions from ceruminous and pilosebaceous glands and squames of epithelium, dust, and other debris. Wax has a protective function as it lubricates the ear canal and entraps any foreign mate. Normally, only a small amount of wax is secreted, which dries up and is later expelled from the meatus by movements of the jaw. As some people sweat more than others, the activity of ceruminous glands also varies. Excessive wax may be secreted and deposited as a plug in the meatus. Certain other factors like narrow and tortuous ear canal, stiff hair or obstructive lesion of the canal. For example, exostosis may favor retention of wax. It may dry up and form a hard impacted mass. Wax is composed of secretion of sebaceous glands, ceruminous glands. Hair, desquamated epithelial debris, keratin and dirt. Sebaceous and ceruminous open into the space of the hair follicle. Sebaceous glands provide fluid rich in fatty acids, while secretion of ceruminous gland is rich in lipids and pigment granules. Secretion of both these glands mixes with the desquamated epithelial cells and keratin shed from the tympanic membrane and deep bony meatus to form wax. Patient usually presents with impairment of hearing or sense of blocked ear. Tinnitus and giddiness may result from impaction of wax against the tympanic membrane. Reflex cough due to stimulation of auricular bulge of vagus may sometimes occur. The onset of these symptoms may be sudden when water enters the ear canal during bathing or swimming and the wax swells up. Long-standing impacted wax may ulcerate the martel skin and result in granuloma formation. Treatment of wax consists 3 types of treatments. 1. Wax hook, 2nd ceruminolitics, and 3rd. Ear syringing. Its removal by syringing or instrumental manipulation. Hard impacted mass may sometimes require prior softening with wax solvents. Syringing, contraindications to ear syringing, non-occlusive cerumen. Previous ear surgery, known tympanic membrane perforation, and unable to cooperate. Methods: ear syringing, first. If wax appears hard, use a ceruminolitic for a few days prior to syringing. Second, cover patient with waterproof sheet, patient holds basin under ear. Third, warm tap water or saline to about 37 degrees Celsius. Fourth, clean, smoothly functioning manual syringe. Check function before starting. Fifth, direct water jet towards roof of canal and posteriorly. Sixth, inspect canal after syringing. Seventh, ideally, dry canal. And 8th, check for side effects. Complications of ear syringing: otitis externa, perforation of the tympanic membrane, trauma to the external auditory canal, pain, vertigo, tinnitus, and otitis media. Debridement, a combination of suction and curettage with appropriate instruments using an operating otoscope or microscope. I hope you guys liked the video, and thanks for watching, and don't forget click on subscribe button.